talk to us about this retesting. What should students do?
Well, basically, I've spoken with leadership at our local schools here in Mississippi. I've been informed that they're following guidelines that are suggested by the CDC along with the Mississippi State Department of Health. And when students contract COVID-19, they have a positive test, they've been diagnosed by their medical providers, what they have to do to return to school is follow a certain protocol. There are three things that must be satisfied. Number one, they have to sit out of school for at least 10 days from when they first developed symptoms or had a positive test. Number two, they have to be fever-free for at least 24 hours without the use of any fever-reducing medications such as Tylenol or Motrin. And number three, they have to have improvement of their symptoms. But they do not, I repeat, they do not have to get a negative test from a medical provider, nor do they even need a letter from their doctor or their medical provider. They can return once they've satisfied this protocol.
Mm-hmm. And is this the same for the employees too?
Pretty much. I mean, everybody's following the CDC guidelines coordinated with the Mississippi State Department of Health, and these are pretty consistent. Now, early on, they made this more that they were encouraging for healthcare professionals, because what was happening was a lot of healthcare professionals were contracting COVID-19 because of the exposure. It retested. But the problem was what researchers are learning is even if you after about 10 days, the data is showing that you're most likely not going to be infectious, but you can still get some of these viral residual particles and cause a positive test. So what the CDC is recommending is you test, because in a lot of cases you put it positive, but the person is not infectious, and that person can be returned to the workplace, especially for healthcare providers and even our essential workers, because there are a lot of functions such as grocery stores and other entities outside of the medical field where we need people back at work. But the good news is the CDC is saying that these individuals after 10 days have a very low probability of getting infected.
Mm-hmm, mm-hmm. All right, there's always ever-changing recommendations when it comes to COVID-19. And just talk to us a little bit about, the latest, staying with your nuclear family and not traveling this break.
Exposure. Basically, it used to be 14 days. The CDC brought it down to 10 days. And if you get a test, it could be 7 days where you can resume life. So you don't have to do the 14 days of quarantine if you're exposed anymore.
Mm-hmm. All right. Well, thank you so much, Dr. Quinn. We got to let you go, but I'm sure we'll hear from you again real soon. We're back after this.